Hi, I'm Dr. Jeff Schels, and today we're going to go over the neck stretching exercises for you, okay? So we're going to go over exactly how to do these exercises so that you don't have any questions as to whether you're doing them correctly, all right? So when you first started, the exercises are designed to stretch the tissues and stretch the muscles, the ligaments, and the tendons, just so that we can start getting a little opening for the nerve, and in combination with the adjustments, try to provide as much pain relief as quickly as possible. So the stretches in the beginning are more just to loosen things up and stretch them out. Eventually, the exercises are designed more to get your spine more into alignment, but in the beginning, it's just mainly stretching and pain relief. So we're gonna go over the neck stretches. Now, it's important to know that when you're doing the neck stretches, you only want to do the stretch within what's called the pain-free range of motion, which means that, like, let's say that one of the exercises is turning your head. As you turn, you go as far as you can to get a good stretch, or you go as far as you can within the pain-free range, and as you come up to the area that's painful, you go right up to that area, then back off a little bit, and just hold the stretch as far as you can within the pain-free range, okay? So let's go through the exercises. The first exercise, this one on the top left side of your sheet, is a flexion exercise. And what that means is you're going to be standing. Now you can do them seated as well, but you can either seated or standing. You're just gonna lean your head as far as you can go straight forward. And this is stretching the muscles and the ligaments and tendons in the back of your neck. So you lean as far as you can go, and you're gonna hold that for 10 seconds. So you just, as you're breathing, you take deep breaths in, deep breath out, you're just counting to 10. And then after you do that for 10 seconds, then you relax for 3 seconds, and then down again as far as you can go. Hold that for 10 seconds. And then relax for 3 seconds. And you will repeat that 3 times. So head forward as far as you can for 10 seconds, relax for 3. Now the next exercise, which is the one on the top right-hand side, is for rotation. So on this one, you can turn your head as far as you can. You can start either direction because you're gonna do both, but you're gonna turn as far as you can to the right and hold that for 10 seconds. Or if you have pain, just go as far as you can within the pain-free range, hold 10 seconds, and then relax for 3 seconds, and then go to the other side as far as you can or in the pain-free range for 10 seconds, and then relax for 3, and then you go back to the first side, and you're just gonna repeat that. To the right, 10 seconds, relax 3. To the left, 10 seconds, relax 3, and you do each side 3 times. The next exercise is for extension. So the very first exercise was leaning your head forward. The exercise on the bottom left-hand side of the sheet is the opposite, it's extension. Now on this one, if you have a history of bad neck pain or a history of dizziness, vertigo, or any problems with that, you want to be real careful with this one because some people can get dizzy. This one is not uncommon for it to cause some discomfort, so you have to be real careful and do it very slowly. And you may want to do this one seated, okay? So what you're going to do is you're just going to slowly lean your head back as far as you can, either as far as you can go until it stops or as far as you can go in the pain-free range, and hold that 10 seconds, and then relax for 3 seconds. And then you just repeat that 3 times. Back as far as you can, hold it for 10 seconds, and then relax for 3 seconds. The last exercise is a trapezius stretch, which is not only for the neck muscles, but the muscles that go out into the shoulder. And so for this one, what you'll do, to try to hold your one shoulder down, you're actually gonna take your arm and put it behind your back. And what that does is it forces this shoulder to stay down as you do the stretch. You'll take your other arm and you're going to reach over and gently grab your head, and as you keep this arm down, you will slowly lean your head over by pulling it, and do this very slowly until you feel a nice stretch. Now on this one, you should feel a stretch out from the shoulder up into the neck. With the other exercises, usually you'll just feel it in the neck or on the sides, but on this one you'll feel it out in the shoulder. So you hold for 10 seconds and then relax. Then you can switch sides, put the other arm behind your back, bring it over, hold for 10 seconds, and breathe throughout the whole exercise, and then relax, and then you'll switch that. So each side you will do for a total of 3 times on each side, okay? So again, these exercises are in the very beginning of your care, just designed to start to mobilize the muscles and ligaments and tendons and get things loosened up so you'll get faster results with the adjustments. If you have any questions, feel free to ask either me or your doctor, and we look forward to seeing you on your next appointment.